Do you love treating pediatrics, but are unsure on how to do it without making the kiddo cry or unsafe, or just making it less painful? If that's the case, then you need to learn about Shonishin. Shonishin is the Japanese pediatric approach that allows you to treat kids without any insertive needle techniques. In this video, I'm going to go through the basics of Shonishin and what you need to know. Stay tuned, it's going to be a great video. Are you excited to learn Shonishin to enhance your pediatric practice? Well, you're in luck, because that's one of the things that we teach in Shinkyu University as part of your foundational education to really bridge the gap between TCM and traditional Japanese medicine. You can find a link for the discussion to allow you to get into Shinkyu in the description box below. It is an interview only based program, so you're going to want to click on that link and set up your interview as soon as you can. So why is learning Shonishin, or non-insertive Japanese pediatric acupuncture, important for your practice? Well, treating children can be really daunting. Needles and other invasive techniques create a lot of fear for the client, and oftentimes you spend the first several treatments just trying to convince the kiddo that it's okay to receive the treatment. Now, I've learned this from several practitioners that I've talked to from all around the globe, everywhere from Italy to France to California. They all say the same things. I really want to treat kids, but every time I have a kiddo on the table, it takes me 3 to 5 treatments just for them to feel comfortable with the treatment. And it gets really hard when you get your 1 to 3 year olds in who have a lot of energy and possibly maybe some ADHD kind of symptoms, and then you ask them to sit still while those needles are inserted. Or you ask that really sensitive sensory kid to have a tack stuck onto them. Oftentimes, they're not gonna like it. And there's nothing worse than having a brand new patient come in with their mom and then making that kiddo cry. So let's talk about Shonishin and how it can really revolutionize your practice. First of all, the history. So Shonishin, or child acupuncture, started in Japan. It's an incredible practice that uses non-insertive needles in order to treat the client. Now, while there are many, many different types of tools that you can use, one of them, a teishin, will look a lot like this. It's going to be a long, kind of pencil-looking instrument, and it's going to have a nice, soft, round tip. And that is because we're not inserting these tools. Now, of course, a teishin and many of the Shonishin tools are variations of the classical needle techniques. And that's why I find them really cool, is that it's a technique based in the classics. Now, the reason why these evolved to not insert at specific acupuncture points, but rather to be used on the skin in a general fashion based on palpation, is the fact that traditional Japanese medicine does not believe that children have formed acupuncture points until about the age of 12 to 14. Now, once they have those formed acupuncture points in traditional Japanese medicine, we can therefore go ahead and use our insertive needle techniques. But for kiddos who are younger than that, oftentimes, even if we were to use insertive needle techniques, we would have to palpate to find the point, because it just doesn't exist where it's supposed to in the textbook. Another thing that traditional Japanese medicine believes, as opposed to TCM, is that the children, again, up until the age of about 12 to 14, do not have fully formed meridians as well. And so oftentimes when we're using our Shonishin techniques, whether it's with a teishin or a chokishin or whatever tool that we're using, we're going to go ahead and do it on sections of the skin, approaching the body a little bit more in the 6 levels rather than approaching it really from specific meridians or specific acupuncture points. Another thing that really differs from adult treatment, especially, to pediatric treatment, but within the Shonishin world, is that oftentimes little kids are just little balls of yang energy. And so when we treat them, we're often treating the yang a lot more than we're treating the yin. Now, this is, of course, not an all the time 100% rule. If your kiddo, for example, has some genetic issues that they were born with, then they might have some yin issues that we would also have to treat, and also if they get really sick as well. But for most kiddos, we're mainly treating the young. Now, before I go on to talk about the tools, I'm going to put in a little disclaimer. That was by no means a full history of Shonishin, by no means. So I really suggest that if you're interested in learning Shonishin, that you do some really good searches. There are a few select good English books out there that are good to read as well, and just do a little bit of research because it's vast. Okay, so let's get into the tools. Now, as you can see from my case here, there are a lot of different tools that you can use when treating kids. Now, there is, of course, a dashin. A dashin is going to be used with a teishin. A dashin is also known in the West as a manaka hammer technique. We have a zanshin. This one I think is really common for those of you who have started to learn Shonishin already. You've probably seen this tool. Now, this tool originally was a little bit more of a lancet tool. It was used more for surgery, probably traditionally. However, right now, the daishiru style, often known here in the West as the tanioka style of pediatric acupuncture, uses this tool pretty predominantly for their initial stage of practitioners. I'm a mid-level practitioner in that group, and that's why I have this tool. It is a very cool tool, but made of iron, so it has its own specific usages. And then also we have some variations of the teishin. This one in particular is called an N teishin. Pretty cool little tool. It's nice and fat. And I have some silver guide tubes. And then you can also have a difference in metals. So for example, this tool right here is actually a 30 gauge needle that I had Aoki just round the tip off. Aoki is a tool maker in Japan, if you didn't know. So your gold tools are going to be much more tonifying. Silver tools, the next level of tonifying. Stainless steel, probably the best price point if you're just getting into it. I honestly recommend stainless steel often for people when they're just trying to figure out what tool they like. It's not going to be tonifying or dispersive. It's just kind of in the middle. And then on the other side of that, we have our copper. Copper is great for dispersing heat. And then we have iron. Iron is going to be really great for just dispersing in general. Now, of course, everyone always asks me, what about bronze? Bronze is actually a really new metal, but I would use it really similarly to how copper is used, so to disperse heat. So I also, just to add in, I missed this little guy. This guy's all a chokishin. It looks like a little butterfly wing. It's kind of cool. It's a very neat little tool. So I very much recommend this tool for people as well. Now, the next question I often get answered is, okay, there's a ton of tools. Wow, oh my God, do I need to get all of them, right? And then what is this cool little case you have? So let's talk about that. So to choose the right tool for your hand, and I have some videos on this as well if you want to kind of look through my channel, and I'll put it in the description box below as well. But to choose the right tool for your hand, you really want to base it on how that tool feels in your hand. So I have actually, for being quite tiny, I have pretty big hands. So I tend to like a tool that's a bit heavier and a bit bigger. Now, saying that, the smaller the tool, the more precise the tool. So my little teeny gold teishin over here, for example, is very specific. It helps me to get to a specific point when I want to. Chokishins are really great for getting at a large area. I find these are really great for kiddos who are moving around a lot, or 1 to 3 year old toddlers, for example. But really what you want to do is find someone who has some teishins and ask them for advice, or at least see if you can hold them. It's really important to hold them in your hands, feel how they feel, see if they feel comfortable for you, both size and the weight. Now, the next thing that you want to think about is how to take care of your teishins, and of course, where's the best place to buy your teishin, okay? So I actually commissioned these. I thought about this, how to make this bag, and then I commissioned a really amazing seamstress to make my little teishin cases. They open and have removable backs in here, so you can put it on a belt and walk it around with you. Especially this is great for people who are treating horses with teishins and other animals. I find this is really helpful, and it's really great for when you're chasing around a little toddler. But these little cases are amazing because they keep your tools from bumping into each other, which makes them scratched. And then there's also a protective layer inside of here, 2 protective layers actually, to help just stop things bumping in your bag and bumping into your tools. So I highly suggest getting a teishin case. I have this one and then a smaller one that I sell on my website, so I'll put a link to that in the description box below. But the next thing you have to really think about is, where am I going to buy these tools from? So I actually recommend, again, if you're just starting out and you have no idea what you want, getting a stainless set is not a terrible thing to do. I don't enjoy the little teeny sets that have little teeny tools. They look like a little Zen gardening set, just because I don't like them. They're a little too tiny for my hands. But getting like 1, maybe 2 stainless tools from the distributor in your local area, I actually think might be a great idea initially, until you get a little bit more used to what you want and what you want to achieve in your practice. After getting that stainless steel tool, there's a few different places that you can start buying teishin from. The ones that I recommend really are either buying from Alki. I am a distributor for Alki, so you can go to my website and kind of look at their tools there. I don't have all of them, but you have a select few. Or you can go to AcuArtistry. AcuArtistry, made by Mark, is also a really great company, so feel free to head over there as well. All right, so now you know kind of what Shonishin is, you know what tools, you know where you're going to get your tool, you have a case, you have all the starting facts. Now you have to actually start your practice. So I recommend that you watch a few of my videos on how to do Shonishin, maybe have a discussion with me about how to start your practice and how to take it further. Again, there's a link for that in the description box below. And then I'd really love for you to start practicing on yourself, practice on friends and family. You can practice on your dogs and cats. They actually quite love it and they give you immediate feedback. And then practice on children. Children are very, very receptive to any type of acupuncture treatment, and their bodies change really quickly. And so I really want to I would love for you all to exercise some caution when applying Shonishin to kids. It looks like we're just doing a gentle massage on them, but it's really, really powerful. So yeah, try to be gentle. A short story about how powerful this treatment can be. So I have a little girl in my care who is now almost 11, I think. And she's almost 10. And she started coming to me about 2 years ago when she was 8, because she had pediatric rheumatoid arthritis diagnosed. She had had it since she was 3. She had very swollen joints. It was hard for her to participate in life. It was a really, really hard diagnosis. It was very traumatizing for her mother. They had tried so many different things and were trying to avoid giving her a biologic at such a young age because of the side effects. And within literally 3 treatments, she was basically pain-free. And she has now been dismissed from a rheumatologist. And every once in a while we have like a little bit of a neck ache, and that's about it because she sleeps on her side, So it can be life-changing for these children to use a technique that is not invasive, really, really gentle, based on where they are today. Literally takes 5 to 10 minutes maybe. It can be life-changing for these kiddos. And like literally that little girl now can live a life where she does not have rheumatoid arthritis, rather than living her entire life with rheumatoid arthritis. So you can change the trajectory of a little child's life for the rest of their life. And I'm talking about the next 70, 80 years of their life. So as a practitioner, it's a really fulfilling practice to do. As a student and teacher, it's really fulfilling for me to teach my students and have them get those results with their patients and get that confidence when treating kids. And for the kids, we're changing their lives, and there's nothing cooler than that. So with that, I would love, love, love to know how many of you are interested in treating kids. Let me know in the description box below. Now, I have several more videos on Shonishin, and again, this is something that we dive into with Shinkyu University in our program. So if you're interested in learning more about Shonishin and really diving deep into the practice, give me a call. Again, link for it in the description box below. All right, that's all for today's video on the basics of Shonishin. I really hope that it was a great video for you. Please don't forget to like, subscribe, and hit that little bell to be notified of future videos coming out all about traditional Japanese medicine. And if you're interested in continuing your journey and trying to find great teishin tools and how to care for them, you're going to watch this video right over here.